Aging LGBTQ population health disparities and healthcare experiences. This presentation will explore whether the aging LGBTQ community experience health disparities which are different than those of heterosexual persons, as well as potential deficits in healthcare related to the aging LGBTQ patient community. This subject is important because there's a large population of people over 50 who identify as LGBTQ, and this is only expected to continue to grow. We must recognize that this sector of the population has unique needs, and healthcare providers should be knowledgeable and considerate in providing care to the LGBTQ aging population. By looking at the aging LGBTQ population through the nursing theory of thriving, we aim to explore the connection between poor health outcomes in this population and the barriers to treatment that potentially contribute to poor health outcomes. We will also discuss how both perceived and real prejudices against this group can lead to depression or anxiety and the effect it has on overall health. Evidence has shown that there's little research on the topic of the unique aging considerations of older sexual minorities, LGBTQ. The research that is available suggests that sexual minorities experience specific health disparities and gaps in healthcare unique to their population. Not only is there a lack of research on the topic in general, but there also appears to be a lack of knowledge among healthcare providers in how to provide competent care to these patients. Community resources and LGBTQ specific healthcare services are sorely lacking. This presentation aims to explore the topic of the specific health disparities that the elder LGBTQ population experience and how healthcare professionals can better support and treat these patients. We will also address the need for more education within the healthcare community in managing this patient population, as well as how collaborative care between provider and community resources can lead to better health outcomes for the aging LGBTQ patient population.
My name is Kristen Williams. This is Nursing 321, Gerontological Nursing and End of Life Care. This is Group 1's Gerontology Group Conference presentation on aging LGBTQ population, health disparities, and healthcare experiences.
My name is Kristen Wilson, a group member of Group 1 for the Gerontology Conference presentation. In the United States, the number of people over the age of 50 who identify as LGBTQ is estimated at approximately 2.7 million people. This number is rising at a rapid rate and is projected to exceed 6 million people by the year 2030. Some of the issues that we found in the older adult population of LGBTQ individuals include that they have a poorer health outcome, higher rate of disabilities, and mental stress. There's a lack of specialized services and programs available to meet their unique needs. There's a history of discrimination during their lifetime that significantly impacts their health outcomes. There is a lack of available knowledgeable healthcare providers. These adults experience higher rates of social isolation and feelings of intense loneliness. They have difficulty accessing care that appropriately deals with the LGBTQ population. They feel discomfort when disclosing their sexual preferences. They experience negative or hostile interactions with healthcare providers. There's a lack of specialized formal care facilities for the LGBTQ population, and then there is bias within the healthcare system. Some of the contributing factors that we found that contribute to the issues experienced by older adults in the LGBTQ population is that they're more likely to live alone, they are less likely to have children, they have a history of being discriminated against that leads to poor health outcomes, they have a lack of knowledgeable healthcare providers, and they experience elderly sexual stigma.
My name is Morgan Gifford. I am part of Group 1 for the Gerontology Conference presentation. We are working on aging LGBTQ population health disparities and healthcare experiences. I will be discussing issues within the healthcare system regarding the LGBTQ older adults. There is definitely a stigma within the healthcare setting and amongst healthcare workers when it comes to the LGBTQ older adult community. Some tend to let their own opinions affect the individualized care for these patients. Lack of knowledge, programs, services, trained professionals for this population, lack of welcoming attitudes, homophobia all lead to one-size-fits-all approach, which does not work for all patients. There are some solutions to this problem, including respecting all patients and listening to their needs and concerns. Have a welcoming attitude. More research studies could be performed to better understand the health-specific issues of the older LGBTQ community. Social support, and training for all healthcare workers. This could include scenarios, speaking to members of the LGBTQ community, and trying to gain a new perspective to better your care for this population.
In conclusion, so what we've learned is that the aging LGBTQ population has grown over the past few years, and we only expect it to continue to do so in the foreseeable future. This population does have specific and unique needs, and those are related to both their physical health and their mental health. The research has proven that the aging LGBTQ population is more at risk for poor health outcomes. This is due to a history of discrimination, multiple discrimination, including age discrimination and sexual minority discrimination, and also a tendency towards social isolation. A lot of older LGBTQ patients don't disclose their sexuality to their healthcare providers, and this is usually due to a fear of discrimination. Research and education is urgently needed to address these issues in the older LGBTQ population. Providers need to be educated about the specific and unique healthcare needs of the aging LGBTQ population, as well as how to best treat them and care for them. Respectful, appropriate, competent healthcare should be provided to all people, regardless of age or sexuality. And we need to work harder to remove the health disparities and prejudices that contribute to poor health outcomes in this patient population.